Good afternoon, everyone. I'm really grateful to be able to speak at such a fascinating event, and I'm aware of the great responsibility on my shoulders because I mustn't keep you from your lunch. I'm the policy advisor at FaithAction. So if we could just have the next slide. FaithAction is a national network of faith-based organisations that are involved in social action or delivering public services or serving their communities in some way. We're based in the UK, mainly in England, and we're multi-faith, and we're free to join. You don't have to sign up to any criteria. We've got about 2,000 members around the country. And what we do is provide support to those faith-based organisations, faith-based charities, to do, so we say we help the doers do. We major on the action element of our name because we find that common to all faiths, people's faith motivates them to care for people and to meet the needs they see around them. And in that way, we can work together, whatever our faith is. So we provide advice and support, training, things like many of our members are quite small organisations. They're not sure how to apply for funding or how to manage a project, so we can help with those kind of things. We also do some research, and we provide a connection with government. And we do that in three main ways. There's an all-party parliamentary group on faith and society, and we're the secretariat to that. We have a relationship with the Ministry for Housing, Communities and Local Government, which funds us to run a programme called Creative English, which teaches English in faith and community locations. And we also have a relationship with the Department for Health and Social Care, which I'm going to talk about now. So if you stay on this slide. So our relationship with the Department of Health and Social Care is through something called the VCSE Health and Wellbeing Alliance. Now, this alliance exists to build a bridge between the voluntary community and social enterprise sector and the health system and the people who use the health system. So it aims to create a two-way channel of communication and allow the voice of people with lived experience in our communities to be included in the policy process through things like producing policy together. So this alliance consists of the Department of Health and Social Care, Public Health England, and NHS England, and then 21 different voluntary sector organisations. Some of them themselves are consortia of smaller organisations. So you can see them all listed there. But the aim is that we cover the breadth of the voluntary sector, not medical condition-specific charities, but we represent different communities who may experience health inequalities or be marginalised in some way or have protected characteristics under equalities legislation. And it's the kind of equalities part that gets us as FaithAction to that table, because faith and belief is a protected characteristic. But once we're at the table, our message is really that faith means a lot of opportunity. And that's the kind of thing we've been hearing about today, that faith organisations are real assets for their communities. So that's what I'm going to go on to talk about. But I would just say that we're often asked by Public Health England especially, what are faith communities telling you are the pressing health issues at the moment? So if you're from a faith community and you would like to get your voice heard more in health policy making, please see me or sign up on our website, and the address will be on the slides. So we've been able, through the Alliance, to do some specific work on a number of different health issues. So the next slide just shows some of the resources that we've produced, that they're all available to download on our website. So we've looked at different things like homelessness, building dementia-friendly communities, and keeping pressure off hospitals. This is all on the next slide, by the way. So we know that faith communities do a lot they do a lot of upstream work to prevent people getting ill in the first place, but they also provide health services, and these things all help to take pressure off the NHS. Have the next slide, please. Thanks. So this shows some of the resources that we've produced. And the one on the bottom left is a review that we did a couple of years ago, which is a review of research and policy looking at the impact of faith-based organisations on public health. And I wanted to talk through some of the findings of that because that will link us into the mass gatherings. So on the next slide, please. In the review, we looked at the evidence base for how faith contributes to public health. We found a lot of good evidence, especially from the United States. There's less from the UK, but building that up is one thing that we'd like to do. And so we found good evidence that health promotion activities in places of worship are making a significant difference to things like healthy eating, exercise, uptake of cancer screening. And so that makes me think, and could make a significant difference to things like preparation for travel abroad for religious gatherings. We also found that involvement in a faith group can be beneficial for well-being and mental health in and of itself through things like providing a social network and connection with other people, as well as a sense of meaning in life, which is good for our mental health. The Cinnamon Network of Churches did an audit of social action in the UK, so the figures you can see on the slide are their estimates of the value of faith-based social action in the UK at the moment, so 125,000 staff, 1.9 million volunteers, and if you kind of put a living wage, I think it was, value on the volunteer hours, we're talking about £3 billion of contribution to the UK economy every year. So faith is providing a significant asset to our society. While, of course, when it comes to health and care services, we need the professional statutory services that exist, and indeed some faith communities or faith-based charities are commissioned to provide those services. It's really what faith-based organisations really have to offer is the stuff that goes round the outside of those statutory services, the things that you can't pay professionals to deliver, like friendship and belonging and a sense of hope and the opportunity to give something back to your community that gives you a sense of meaning in life and purpose. But we face a bit of a double challenge with this. One is that the health and care system is not always maybe aware of what faith communities are doing, or is maybe a bit nervous of working with faith for many reasons, but also that faith communities themselves don't necessarily recognise that the work they're doing has a value for health and well-being. So just for example, if you run, say, a lunch club for elderly people, you're not probably going to think of that as a health project, but it doesn't take much to see that there will be health benefits for those people involved. And then next slide, please. We found also that we can say there are a number of specific assets that faith communities and faith-based charities have to offer to health. They include a culture of volunteering, buildings often in accessible locations that are open, long hours, not just working hours, a substantial and distinctive social capital that faith-based organisations provide. They often have expertise in their communities that have built up over a long period of time. And again, they have longevity within their communities. They often have leaders who are really trusted as messengers, which is an asset when it comes to putting out health messages. And they have an ethos of care, especially to the most marginalised. So if you're from a faith community, this probably isn't news to you, but we find that some of the people we talk to in the health and care system find that is kind of news or not something they hadn't thought about before. But what does it mean for religious mass gatherings? So next slide just has the question on. We've just been doing a little bit of thinking about this and seeing what ideas we could come up with, but it's something we'd like to consider more. So maybe some of the things we would like to see are whether we could use faith locations in the UK to prepare people for travel abroad through greater partnership with GPs and pharmacists. So the kind of programme that Dr. Shuja was just mentioning, what does that mean for the UK and what does it mean for what faith organisations should be doing? But also, what does it mean for GPs? Are GPs aware of all the faith organisations in their local community? Are the pharmacists aware? Are they making those links and thinking about where there are mass gatherings abroad coming up? What could they be doing to link with those faith organisations round the corner from them? Are there leaflets that could be given out as soon as somebody goes for certain vaccinations? I'm not sure. These are just ideas we're thinking about. And I was also thinking about mental health. and whether we could use conversations that go on in faith centres about pilgrimages that might be coming up to mention mental health and try to overcome some of the stigma that still exists around mental health, whether it's talking about maybe you're anxious about travelling, or maybe you might have had panic attacks in the past. What happens if you have a panic attack in the middle of a crowd? Are there people you can talk to, whether they're in your faith community, or is your faith community making you aware of people you could talk to in terms of other health services? So these are interesting things to consider. That's all I wanted to say. The next slide is our website, so I'd encourage you to visit that, and it has my contact details on. But I'm staying around for lunch, so I'd be really pleased to talk to anyone who'd like to know more. Thank you.